professional body that constitutes of hospital and healthcare administrators across India. The team of AHA has done a credible job by conducting these webinars on every first and third Saturday between 3 to 4 p.m. I believe that this is a platform to share knowledge, discuss innovative ideas, listen to our experts, and enhance our knowledge overall. So the topic of today's webinar is Green Healthcare, Challenges and Opportunities. Before we proceed further, I would request our AHA President, Dr. Yashpal Sharma sir, to please bestow a few words of your wisdom. So over to you.
Yeah, thank you very much, Dr. Shaista. First of all, I must compliment Dr. Mahesh Devnani. He has been doing excellent, and we have, been able to organize the webinars very regularly, and these webinars are being conducted fortnightly. Today we have with us Dr. Shivraj Dhaka, who is Senior Counsellor, Indian Green Building Council, and very well-known figure in the field. And he'll be talking on the green healthcare challenges and opportunities. So I welcome him, and I must also compliment Dr. Shaista and wish her good luck for today. And I'm sure that today's webinar is going to be excellent webinar, as it is being, done in the previous times also. And as far as the green health is concerned, I think we have many challenges in implementation of the green health in the practices in the hospitals, especially the high cost in implementing new technologies and practices, and switching over to renewable energy sources such as solar and wind power requires significant upfront investment. And then another biggest challenge which I feel is the lack of awareness amongst the healthcare professional and the general public. So I'm sure that, with today's webinar, and we have the expert with us, Dr. Shivraj, we will be able to, know much more about the green healthcare, and we'll be able to implement in the healthcare sector for the better outcomes. I hand over to Dr. Shaista, and I wish good luck for today's webinar. Thank you.
Thank you, sir. Thank you.
Thank you so much, sir. As the topic of today is green healthcare, the challenges and the opportunities, green healthcare topic is the need of the hour to be known by all hospital administrators. Green healthcare not only emphasizing on the reduction of wastage in the hospital, but yes, gives us a window into how can we better manage the biomedical waste, then reduce hospital-acquired infections, improve the energy efficiency, and use more and more natural resources, and sustain the environment and make it more eco-friendly. Now, this is the time when I would introduce our speaker, that is Dr. Shivraj Dhaka. So I welcome you. I have got this opportunity to know him personally, and as his name is very godly, Dr. Shivraj, I would say he's a very humble and a pleasant personality to talk to. He's somebody who's keenly interested in his field and inspire all of us to be hardworking and show perseverance in doing and contributing to the system. I think we could not have any other speaker than him on this platform today because of his great experience in the field. He is academically, he is a mechanical engineer. He is a PhD in energy efficiency and thermal control from KIT, Germany. He has been a senior consultant in IGBC from past almost more than 15 years. And there are a lot of publications which goes credit to him. Around more than 20 publications he has, which are of national and international importance. Also, I would like to mention he has been an active team member of ISHRE. And yes, more than almost 400 green buildings he has given consultation for. So not taking much of the time, I would handle this platform to serve. But then before that, I would just give few instructions to all the participants that please your mic on the mute mode. And yes, we would be taking all the questions, but at the end of this webinar, you can put your questions in the chat box. Also, I would request our seniors to please share your experiences in green healthcare at the end of the session. So over to you, Shivraj sir.
Yeah, thank you, madam. And I will try to share my presentation first. I think you are able to see my screen now.
Yes, Shivraj, yes.
Yes,
Okay. Just a moment. So I'm really, really grateful to AHA, and more than that, I had wonderful discussion with Dr. Mahesh Devnani sir about 2 weeks back, and we are really fortunate to get connected. Many times, what happens? We are doing same kind of work for the betterment of the society, betterment of the whole healthcare sector as well as for India, but somehow we are not getting connected much before than what we expect. But again, God grace, we are connected, and we will try to push our agenda. We have common goal, and we will try to make healthcare more sustainable than what we have today with our efforts. I am really thankful to Dr. Shaista Ganai, who is medical officer. We also had call last week, and I am really so happy to speak with her about what she feels about the healthcare sector, how it could have the journey while incorporating many of the green concepts. I would not take much time, but we are really thankful to HA for this opportunity, and we would try to make our hands together, join our hands together, so that we try more and more good things for the whole sector. The building which you see it here, it is one of the center of excellences of CII. It is located in Hyderabad. By any chance, any of the attendees or the leadership team of AHA, if you are there in Hyderabad, please try to visit. You would be really happy to witness many green concepts, which are in general very simple to say, but really making sense for the building with regard to operational cost also. Just now, President AHA mentioned about the cost economics. I would try to cover some of the measures in coming slides. But if you are there in Hyderabad, please try to visit. And let me tell you, it was the first green building in the country. Whatever we see, whatever we hear on green, all they started from this building. And today, this is not only the green building. It is the first, or it is India's first net zero energy building on operational basis. I would like to cover many more things in coming association, but at this present, we only covering like green healthcare. So this presentation would cover green buildings, green healthcare, what are the opportunity challenges, the rating program which we have developed. So what are the processes involved in that for any of the hospital to get green compliance there, and what is the way forward with regard to how we associate closely there. So this framework is developed by IGBC. IGBC stands for Indian Green Building Council, and vision of IGBC is to have sustainability for all the built environment. Whenever we talk about any of the building typology like healthcare, it is only one of the verticals of the building sector. So we are looking for having the leadership role at global level by 2025, and to have the biggest green footprint across the globe. When we talk about IGBC, it is also part of World Green Building Council. So as I mentioned, this is the one building which paved the path for green in 2001. Hardly we have about 20,000 square feet, but if we see the number of projects today, it is more than 11,000. And these 11,000 projects, they are covering from all building typologies, whatever we see in the industry. So when we talk about building typology specific rating frameworks, we have programs for net zero. We have programs for commercial buildings, residential, transit, built environment, which are like very large size project, education sector, as well as we have programs for industrial. But finally, we are talking about What are the key measures which can be incorporated for healthcare facilities? So we exclusively developed one rating program. It is not developed by IGBC. IGBC is just facilitating the program, but it has been developed with by a very elite committee. That committee was headed by Dr. R. Chandrasekhar. He was a chief architect at Ministry of Healthcare. I think many of you would be knowing him as well. Then we have another program which is primarily developed for well-being of occupants, whether it is hospital or any other typology of building. So when we talk about green building, although it is not a subject today, but we will take many more things from green building to green healthcare. So green building is one which uses less water. It will have optimized energy efficiency. It will have the highest optimum level of building materials. It is a big subject today. Whatever we speak about materials, it is very big subject to today because it has created a burden on environment because of like unnecessary material transportation. Green building will have lesser waste. And finally, why we make all these efforts, they are finally for better health of occupant there. So these five elements, which are like related to site, water, energy, building materials, and indoor environment quality, they are addressed in every green building, whether we talk about green hospital or green office or hotel or many other typologies. When we talk about healthcare, we understand these five verticals are important, but priority would be different. So in a healthcare facility, our prime goal is how we can support our patients. Supporting patient is one part, but can we also support our staff members because they are almost every day there. They are working 24 hours during daytime, during night time. So how we can support their better health? Whatever the problems patient doesn't have while having their entry into the hospital, they may have many more. So can we avoid hospital acquired infections? Can we avoid these infections for the staff as well? And how we can make our facilities future ready with regard to whatever we speak today. It could be green building or green healthcare. It could be net zero. Whole country is talking, whole globe is talking about net zero. How we can be future ready for it. So this rating program was developed in 2016 and then further revised after or during COVID. It has many of the requirements, whatever we see or whatever the problem we find in healthcare industry today. So, as I mentioned earlier, these five elements would be further addressed into green healthcare, but priority would be really different here. When we talk about green healthcare, the indoor environment quality is very critical, crucial, and it is really essential to understand and implement there. Whatever the efforts we can make for well-being, it is also a high priority for this sector. And the last part is like sanitization and hygiene. It is a great deal for every hospital to deal every minute there. So this bifurcation comes to IQ about more than 35 to 37%. And then we are having good weightage for energy conservation, water conservation. As you understand, energy makes business sense. If we implement some of the measures today, we try to get benefit from the moment we have their installations. So it is really important for every hospital, and most of the hospitals, they operate 24 hours, 365 days. So energy is a good quantum for them to consider. Water is also a problem, although many of the hospitals, their demand could be lower in some of the sectors, some of the regions, but they continuously have more and more water users. And there are challenges in some of the cities where water is not available, or there is a huge scarcity of water availability. Then we have some weightage for building materials, site selection, and some of the other things. But I think our prime focus is how we can have better healthcare facilities, trying to have at least like 50 to 60% weightage covering from IEQ and energy efficiency. Even then, it would be having huge benefit to the hospital. So now I would try to cover some of the measures in five elements. When we talk about indoor environment quality, you know what happens in green buildings, they would try to have some mandatory requirement. Mandatory means any of the hospital project, whether it's a small or big or any of the location, they have to meet some of the requirements. So for indoor environment quality, Ventilation is essential, ventilation is mandatory, and this ventilation happens to many of the hospital, but our target is this ventilation should be as per the national or international practices. So it is mandatory. Then some of the other requirement, I think it happens all across the country today, but we have to rigorously do it. Then there are reward. Reward means for a mandatory requirement point, there would be no reward to any of the project. And anyhow, they have to implement it, they have to practice it. When we talk about reward program, there are certain credits defined for some of the areas. Let me introduce some of the credit here. Suppose we have indoor environment quality credit 1.1. This will address healing architecture. One of the other principle would address healing architecture through connectivity to nature. So these many different parameters would be there for every green healthcare facility to incorporate, but we can't say like it is mandatory for every facility to do that. Sometime when we design new hospital, we will have many more flexibilities to incorporate, to adapt them, but in an existing hospital, many of the things may be possible, may not be possible. So because of that, this kind of criteria has been defined. Now let me give you some examples about some of the parameters what we are looking for and what kind of benefits green healthcare may avail while going to this process. So when we speak about indoor environment quality, it will have many more parameters, but some of the parameters which are really crucial for hospitals is air quality. Second part is healing architecture, and third part is comfort. And comfort, in fact, has 4 or 5 important variables. Many times we need to understand them and try to have these measures for hospitals so that we get better resource conservation and our patients are more healthy there. They are really staying less there. So indoor air quality will have fresher ventilation, but we have different type of spaces in every hospital. Some spaces would be fully air conditioned, airtight. Some spaces would be mechanically ventilated. Sometimes we have hybrid ventilation. Sometimes we have some different requirement for ventilation. So these ventilations should be following some of the protocols. I will cover in the coming slide, like what are the protocols defined for them. But having ventilation is one of the important things for green healthcare, but we need to monitor also. Sometimes we define ICU for 30 bed, 40 bed, 10 bed. So we can't put the same quality of air monitoring system there or same quantity of air ventilation system there. We need to quantify so that if we are getting some difficulty there, it will have further flag off for us and we can improvise the system as a whole there. Second part, many a time we try to have some space where air changes is really high. We have to replace the total amount of air volume more than 10 times, more than 15 times in a hour. So these are some of the requirements with regard to air quality. Then second part is how we provide daylighting there. Daylighting is also an important factor to consider for every hospital, and daylight is one of the important variable where they try to address many more healing environment for patient as well as for the occupant. Connect to environment. Connect to environment. Our basic philosophy is wherever we provide inpatient rooms uh, uh, or beds, these should be connected to the outdoor environment. You may have seen some of the hospitals, they are having 100% area which is open, and patient who is admitted can see the outdoor environment. He will have lot many relaxation. There are several studies which have shown like what kind of benefit or how much reduction in patient stay can be reduced by providing this kind of environment. Vegetation, it is not having essential for the hospital to provide and look after, but the vegetation which we provide near to the periphery of the hospital or for some of the other applications, it will have many more benefit to patients. Patient-centric healing spaces, they are also required in green healthcare facilities, and we have put some numbers. So these numbers would help some of the like 5%, 10% patients, those are admitted in the hospital from last 2 or 3 days. If they find some time, if they are allowed to go to these spaces, their healing also goes up. Color psychology, you would have lot much experience than IGBC also. but it is a really making good sense for hospital to consider. When we speak about thermal comfort, acoustic design, ergonomics, stress living spaces, low emitting materials, there are many things which can give better comfort to occupant, better comfort to patients. But how to do them? It is not easy. Like we had tried to address every component there so easily. There would be some challenges. We will try to understand some of the challenges. Those are defined in green healthcare. And what could be the way forward to resolve these challenges and make them as an opportunity for the hospital to consider. So when we try to have indoor air quality, it will avoid many of the things which are creating problem for the occupant. Those problems are problems are catered to, like sick building syndrome. Then many hospital would need more and more daylight and ventilation. And let me tell you, like ventilation is one of the critical problem in several hospitals. Like some hospitals, they will have their ICUs and even OTs. For smaller hospitals, they are simply having split ACs. So we need to have them. What could be the better approach, so that they follow and try to avoid more and more infection which are spreading all across. While considering the fresher ventilation, the main thing which we have considered is SRA 170 standard, which is primarily developed for the ventilation of healthcare facilities. If we try to follow, we will understand easily based on the type of spaces, whether we have OT or ICU or general ward or some lobby or offices. There would be different requirement of the different requirement of ventilation and minimum air changes required. And these are making two sense for healthcare sector. One is try to avoid the healthcare or hospital acquired infection. At the same time, they are the real medicines for the healing to patients. For naturally ventilated space, we have provided some numbers. Let me tell you one simple number. For some of the spaces in hospital, we have asked to provide at least 15 to 20% operable windows in any of the space. If we provide that, it will have better ventilation, better cross ventilation. But many a time these windows would be completely locked. No one can operate them. So this would not be like a hospital, but environment would be very similar to like hotel. One more important part is placement or location of treated fresh air units. When we provide the ventilation, when we try to put more and more fresh air to the hospital, they would be from some of the mechanical equipment, and these mechanical equipment, they are closely located to some of the exhaust. So whatever the exhaust we have put out, same exhaust or some portion of that exhaust would be going back to the hospital. But while considering all these parameters, I hope we have understood like why we are doing all these things. So we are doing just to have better human comfort, as well as the human will have some specific requirement with regard to ventilation. And that ventilation we can only provide if we pump the more and more fresh air there. Second thing, we are in modern era where we use many chemicals for everything. These chemicals are made of many different type of chemicals, and these chemicals would have several carcinogenic properties into it. So these properties, in the morning we have a healthy system, we have some of the space which are completely clean, but once you put the chemicals, it will have more and more pollution. So we need to avoid source pollution. At the same time, whatever the ventilation we provide, it should address the requirement of human being or the patient or staff there, as well as the built environment whatever we have there today. When we talk about healing architecture, it is to help a patient for better recovery, fast recovery, to reduce their stay time into the hospital, to have lesser HI infections also. So there are many good things with regard to healing architecture, but some of the properties are like daylit spaces. We need to provide at least a percentage of daylit spaces in every hospital. Let me tell you, one of the code which is there for energy compliance, it is asking every space which is having daylit should have daylit for at least 90% of the time in a year. This means like we have 8760 hour in a year. Out of that, some 2900 daylit days would be there. Out of 2900 daylit days, we need to have at least 90% of the delete into particular spaces also. So can we achieve that goal? If we achieve that, then we don't need to really worry about how patient will have better faster recovery there. It is by default into our design. Connectivity to the nature, really important. We need to understand what is going outside, and many of the time we also understand, and it is like behavior as well as our psychology. When we understand, okay, today is like hot day or a winter day or so, we automatically changes our clothes, or we changes our the pattern of clothing. Same is the case with patient. If they are connected to the nature, they understand like what kind of environment changes are being happening. It is hot, summer, and their mind would change. So most of the time, our behavior is like medicine for us to heal it. It is not only the medicine which works for healing. Green open space, absolutely, it is really important. Healing garden, color psychology. These are some of the parameters which are related to healing architecture. You can also see some of the hospitals where we have certified what kind of amenities they have provided for. And see many more good examples in our hospitals also. What are the stress relieving spaces we have created for attendant, those are coming with the patients. These are some of the examples with regard to color psychology. I would not be going in depth, but yes, they are really helping patient to have more and more healing environment into the hospital. So some of the spaces, they are also required in green healthcare to be provided for better patient-centered design, or we should also say like evidence-based design. There are some of the evidence we already know in our hospital, and based on these evidences, we should try to have our hospitals green. Some of the good examples are like acoustic comfort. It is really important, and if you don't address, many a time when doctor consult to patient would not hear completely, and even if he or she misses one tablet in a particular day also, it may have like lot many other impacts. Ergonomics is also a good subject to be considered, but we try to measure like what kind of ergonomics hospital has been providing there. So some stress living space like yoga, meditation, music, they may be offered in hospitals. So second area is like sanitation and hygiene. As we understand, this is really a great requirement for hospital with regard to how we manage our waste. What kind of waste we can segregate at different sources, and how it goes to the central as well as the disposal. So these are some of the mandatory requirement which are essentially they have to implement into the hospital for going green certification. Then there are some reward like infection control within the space, isolation room, sanitization, eco-friendly cleaning practices. This is really important. This may avoid our source pollution. Many times we try to put some of the chemicals which are having lot many different type of VOCs. And these VOCs, if we don't have in the morning, after cleaning, we will certainly have there. And we are not inhaling them for one day. Many of the doctors or the nursing staff who are there in the hospital, they are inhaling every day. So one inhaling will not kill or will not have many adverse impact. But if we do it for regularly for many decades and years, it will have lot many good impacts, which are really bad for the health. So there are some practices with regard to how to have the sanitization and hygiene into a hospital with regard to the dilution, filtration, pressurization for different spaces, and how we have the antibacterial surfaces or the design parameters with regard to not to have any corners into the into several spaces of the hospital also. There are some requirement with regard to purification. We have also set some of the guidelines, what kind of filter should be put into the treated fresh air units, or some of the mechanical air conditioning equipment, which are really necessary for different types of spaces there. There are several good practices with regard to municipal waste management, biomedical, and some hospital projects, they have provided automated solid waste management, not to have any human interventions, and they are well collected at the disposal. So I think we are working with one of the biggest hospital in NCR, and with that hospital, we will try to have some new benchmark in HAI. So right now, whatever the HAI has been defined, it would be much lower than some of the hospitals, and there would be new benchmark set for it. Many time, some of the international studies they have shown like what is the rate of healthcare or hospital acquired infections, and how they are really critical to understand today, just to avoid illness or some of the critical diseases for attendees of the patient, or in fact patient as well. So there are some of the measures how to avoid them, and if we do it and regularly practices, there would be some monitoring also how to do it, and what kind of monitoring would be required on some frequency, so that we really take some necessary actions there. So just to control the infection, there are many other areas to consider, but most of the important area would be to have better ventilation. Once we have the better ventilation, many of the problems would by default be avoided into the green hospitals. And second thing is like delete. If you have seen some of the older concepts, like kitchens, they are towards a corner, and that corner would be in the east and south. Why we want to have that? Primarily, there would be good sunlight, and kitchen will have lot many wet areas every day of different things. So daylight self kills bacteria. It will try to have more freshness into the areas. So these kind of things are defined, but with regard to mechanical ventilation or pressurization systems, they are also part of green healthcare. These are some of the modern solutions with regard to purification. But whatever the modern features we do have, we also need to understand the requirement, and need to have better operation maintenance for it, because they are not good for many of the like eyesight, or many of the threshold limit whatever we see in the industry. So UVGI lamp is a good practice which has been practicing in healthcare industry from a long time, but after COVID, it has been realized in many of the hospitals as well as commercial building to put and integrate with the air handling unit systems. Then some of the other measures with regard to high touch or antibacterial surfaces, they are also be part of green healthcare. These are about to isolation rooms. We have some requirement like 10% of the total inpatient capacity should be there for the isolation rooms, and this can be having some good filter media. Although filter is like again a big area to consider, and there are lot many challenges like which filter makes good sense for different type of spaces, whether it is OT or maybe ICU or NICUs or general ward also. So when we try to follow some of the best sanitization and the cleaning practices, it will try to avoid our some of the problems related to HI or patient healing, or some of the other problems those are coming from the HI also. These are some of the examples where automated solid waste management has been practiced in some bigger hospitals. Now coming back to water conservation. Water conservation has been realized in the last couple of years, very sensitive in some of the areas where water scarcity is huge, and at the same time quality parameters are also really challenging. So for these parameters, we need to have periodic testing. I'm sorry, some overlap. Yeah, sorry. So these water conservation measures related to rainwater harvesting management, then it will have huge focus on water efficiency, and then finally water treatment and reuse within the facility. So there are some couple of examples giving why we want to consider them, and today it is making some good business sense also. In some of the areas, even municipal water supply is not there, and borewell water quality is truly bad, and they are fully dependent on water tankers, and these are really costly affair, because there would be huge requirement for hospital to have water consumption there. So we follow the practice of like reduce. We have to reduce the water consumption by putting water efficiency into it, and then it must be reused there within the facility by having different type of treatment facilities. We are working with some of the new technologies. Those are treating waste like new water, And this new water can be used for dual flushing lines, can be utilized for mechanical equipment system like cooling tower also. And same is the case of this water to reuse for irrigation purposes there. Recharge is mandatory by central as well as state pollution control board for all the hospitals. But we need to have good capacity of rainwater harvesting and then reuse this quantity for some of the good applications. And today we are monitoring water similar to energy. So there are better practices for water metering, monitoring, and trying to have the complete dashboard for it. Let me tell you some of the good benchmarks which we have received from the hospital with regard to water conservation. So their water consumption we found per bed per day it was around 600 liter for conventional hospitals, but for green hospital it was in the range of like 120 to 600. 600 was found for some of the hospitals where their load or capacity is like very huge. We found significant reduction in green hospitals while considering the water conservation. When we have a landscaping requirement which happens today to many of the like large hospitals, there is a thumb rule like 6 to 8 liter per day per square meter is the water consumption for irrigation. But in a green hospitals, because of some of the good technology which are being utilized there, it would be hardly like 2 to 3 liter per day per square meter of landscape area. Flushing can also be utilized, irrigation or cooling tower which are used for the mechanical cooling into hospitals. They are also having lot many performance benchmarks in green hospitals. So this is energy efficiency where we talk about how to reduce ozone depleting potential. Although today's refrigerant, they don't have any ODP into it, but they would be having really very high global warming potential, which is called like GWP. So this is one mandatory requirement. We can try to have most of the emerging technologies or the solutions which are not having any ODP, and their GWP would be hardly 200, less than 50, less than 100 or so. Energy efficiency, we are following energy conservation building code, which is mandatory from Bureau of Energy Efficiency, and every nodal agency from the state, they would also enforce it. Commissioning of every equipment, it is really critical, important for hospital to commission them as per our design goals. As President AHA mentioned, there are costly affairs for renewable energy on-site, off-site, or just to make sure we are having more and more renewable energy penetration to the hospital. What we see today, renewable energy has become a baseline for every building. Doesn't matter whether it is hospital, hotel, or any other typology of building. So on-site, whatever the space we do have, or whatever the space is there on the rooftop, can be utilized completely for renewable energy generation, and it makes truly a business sense. And earlier we thought we don't have sufficient money to invest and then get the renewable energy done for our hospital. But today this is not the case. Even some of the hospital, they are really not interested to invest their money. They can have some different business model like OPEX or some pay as you go or so that there is no investment. At the same time, your energy tariff is reduced significantly for the better benefits. Now, next part is like energy metering and monitoring. Already, many of the hospitals, they are doing for the better resource conservation or monitoring. But energy efficiency makes business sense for every hospital. If it is implemented into design, there would be many more benefit to the hospital. But even some of the equipment which are running from long time, like air conditioning or some of the ventilation system, or some of the spaces like ICUs, NICUs, where we have put very exclusive or sophisticated mechanical cooling system, it may have some more integration to save more energy for the hospital. So we are following 2 codes. Any of the codes can be referred for energy compliance, whether it is energy consumption building code or could be SA 90.1, which is like exclusively for energy efficiency. And for ventilation, already we have discussed SA 170, which is made for only hospitals. So this kind of energy practices may give 30 to 40% energy savings. And many a time we have seen in some of the hospitals, they even get more than whatever the recommendation we have put energy savings, because some machines, they are installed from long time, and because in hospital it is like really crucial to have some shutdown. So they have put like overcapacity of it, or some controls would not be integrated when they were designed about like 20 years back or so. But today, considering the advancement in the technology, considering the benchmarking, whatever we have today, it was not there about like decades back or 2 decades back. So they are really, really energy efficient, and they are well metered and monitored and tracked for their performance. So we have seen the energy performance or the per capita energy consumption for these hospitals. It was around like 200, 275, or less than 200 also for some of the smaller hospitals where air conditioning area is about 30% or even less. But for a green hospitals, because we are following some of the standards, protocols, codes, well practiced at national level as well as international level, their energy benchmark are really, really less. So still we are doing some more studies with support of some agencies, trying to figure it out what could be the energy benchmark or per capita energy consumption with regard to number of beds for hospitals in different climatic zone of India. But it is a significant opportunity for any of the hospital to look after their old equipment and then try to have some retrofitting. Whether we are doing today or tomorrow, after some years or time, we have to do it for the net zero goal. So we are in like early stage to do it so that we get more benefit tomorrow. So these are some of the energy performance benchmark. I don't think like we are really having these numbers today in the industry, but there are more and more advancement into most of the cooling system, most of the lighting fixtures, and many of the systems which we put for the better ventilation into hospitals. They are made really energy efficient today. One such example, like what are the areas which can be considered and how much saving can be proposed from baseline. Baseline is like our design case, which we are putting all the code compliance requirement, and then finally, how much reduction we can do in our hospital design so that it makes more business sense when we operate it. These are some of the examples for renewable energy. Now we have entered into next area, which is about building materials. As I mentioned earlier, it is a very, very big area to consider. Whatever the materials we have for one of the hospitals which is under design or maybe in construction, you can't imagine there would be more than like 2,000 to 3,000 different materials required for the hospital to get it fully operational. These metals, they are being transported from one place to another, and if we consider their carbon footprinting, it is like huge number for it. So today we should have good practices, we should have some of the green procurement guidelines so that we are not creating burden on environment. While considering any of the metals, we would have more and more preference for the local. So this is the methodology which we follow in the green healthcare while considering building materials. So whatever the materials we have, it should be locally available. Metals should have more and more recycled content. Metals should have eco labeling. Eco labeling means there are some guidelines. If products are meeting some of the guidelines or requirement, they may be eco labeled. You may have expertise in X area, Y area, or G area, but one cannot understand like each and every part of these chemical properties or building materials or lot many materials which we utilize for our hospital projects. So if we see the logo there, we can understand, we can make sure, oh, this product is good and it is having low carbon content, or it is not having any volatile organic compound into it. Some examples, like having the recycled content, local source material, eco-friendly materials. These are some of the good examples for building materials. We also try to define some benchmark there. If building materials are made of like high recycled content or their properties, they could be far better than what we used to have earlier with like double brick and plaster both sides. There are wood-based material. Again, we are requesting whenever we try to procure this kind of material, we should ask the eco labeling for it. And this eco label would make sure the volatile organic compound gone into the manufacturing is like almost nil. There are some certifications which are like green product certification or green eco labeling. These products are well utilized in green buildings or green healthcare. The last part is site selection although it should come first, but because in healthcare our prime focus is not only the site selection or planning, but it is like how to have our hospitals more and more resilient with regard to infection control, with regard to more and more faster recovery of patient, and having their less staying to the hospital also. So there are some compliance requirement which is really mandatory for every hospital, is like local building regulation, soil erosion control. Today we are talking about energy, water, or air pollution, but are we really talking about soil erosion or like soil pollution? But many great institutes and organizations, they have already started soil saving programs. So we need to prevent the soil erosion, and there should be better control for sedimentation, so that we utilize our topsoil for better usability into the project. There are many other reward program or credits points for every hospital to consider under site. They are related to how to have integrated design process, how to have passive architectural which is well integrated into the design of hospital. And there are some other measures related to urban heat island. When we are there in the city, core of the city, we find more temperature. While going outside, we find slightly lower temperature. This difference is called urban heat island. So how we can mitigate these urban heat island measures, so that our surrounding or the microclimate would be far better than what we have in conventional designs also. Outdoor light pollution, we are trying to disturb like all the nocturnal pollution, or all the birds which are flying in the night. We are trying to disturb because of the more and more light pollution which we have created through our projects. Universal design, it is by default mandatory, but many projects, they really don't have each and everything in place, so that when we don't have some of the measures, it is like difficult to get it like mandatory. But universal design is one which must be well addressed in every hospital design. It has been well addressed in every different typology as well. So there are a couple of examples how to have it. There are topsoil which is preserved, and then it will be reutilized when we have our landscape ready for it. If we follow this kind of practices, our landscape will never require more pesticide to grow our plants there. By default, it will have good fertility into it, and there would be lesser water requirement. There would be more life to our natural vegetation there. This examples is just to showcase what kind of lighting fixture we should install, so that we don't pollute the whole environment there. You can just imagine when we install this kind of lighting, what happens, and when we install the best of best, which will only illuminate the right places which is required for the pathway over paving there. There are another examples which are there for soil erosion prevention control in many projects all across the country. This is one area for consideration. Urban heat island will impact the human health. Urban heat island would give more and more emphasis because it will increase the temperature, and once we have more temperature, about like even half degree or so, there would be many different diseases or kind of problems would happen to the general public. So how we can avoid it? Some of the hospitals, they have provided green vegetation, but sometimes it will consume more water. So we need to have some compensation, whether we need more water conservation, or we need to address the urban heat island, or what are the good practices which can give better benefit with regard to UHI as well as water conservation into the project. One more example is there where this vegetation roof has been provided. This can be well utilized for healing garden. That healing garden will help patient also to get better recovery there. So what could be the national benefit of green healthcare? One is it addresses sustainability, which has become a core area for everyone, whether it is government or private. Today, sustainability has been well addressed. It reduces resource consumption with regard to energy, water, and also reduce the carbon footprint. And obviously, it will reduce HI to the greatest extent. It introduces wellness for healthcare professionals as well as the patient. It augments some of the policies which are there. We are also working with some central government, some of the medical agencies to have some guidelines for all the hospitals which are like slightly smaller than the district hospital also. So we have defined these benefits in two categories. One is tangible benefit, where we can account it, and some of the measures we are not able to account it, or we are not able to quantify it. So these measures would be defined in intangible benefits. So having daily space, it can recover, it can have faster recovery of patient by 15%. There are plenty of reports available for everyone to read. It can reduce the patient stay by at least like 35 to 40%. When we have our patient rooms or design of the hospital, which is having better connectivity for every person, whether staff or patient, it may reduce the stay about eight to 9%. Sorry, it may have better health and hygiene. So there would be some relaxation with regard to infection control if we provide this kind of measures. When we count tangible benefits, as presidents are also mentioned, there would be huge opportunities for the hospital to reduce energy consumption by 30 to 40%. But still, it cannot be like 30 to 40% for every project. It depends on lot many other parameters also, age of the hospital also, condition area of the hospital also. There are many factors about it. But yes, there would be significant savings for the hospital. Same is the case with water. It can be reduced by 20 to 30% because we are trying to follow some of the codes which are well practiced at state as well as the country level. So these codes belongs to like Uniform Plumbing Code for water conservation and Energy Conservation Code for energy efficiency. One good example we thought to share with you, like this is a hospital. We haven't put any name here, but this hospital has addressed many green principles. It has provided almost like 70 to 72% of area which is closely connected to the nature and which is regularly occupied by patient or staff members there. Green open space, normally we see like 5%, 10%, but this hospital has provided more than 32%, which is excluding the building footprint. Healing garden, it is about like 22% of the total open space or the landscape into the project. Color psychology is also well addressed. So this kind of hospitals, they will really make a major milestone with regard to their journey to green and the net zero. So while coming to the green healthcare certification, or how it can happens to existing hospital or maybe a new hospital. So primarily it addresses both new and existing. We have the different compliance requirement for existing and the new hospital. It may be adopted by a community health or district or public private hospital, from smaller to like at a very large level. Even we are also doing some projects already, completed some project in the past. We have done this green certificate, this green healthcare certificate for medical institutes. In medical institute, what happens, some buildings would be only for hospital purpose, some building would be admin, some building would be laboratories. So there would be different compliance rules for different typology of buildings there. So there are 4 levels of certification that happens for every green hospital, and this happens based on a 100-point scale. So whatever the 5 modules, 5 elements which belongs to nature, whatever we considered and discussed just now, these 5 elements would be having 100 marks there. Out of 100 marks, if any of the projects is able to secure about 50 to 60 marks, it would be called certified hospital. If that happens for next level, it is like silver, and finally it happens for gold and platinum. So these are the marks which are based on the framework which we have just defined or just discussed. In case of existing healthcare, it cannot be much similar to like new healthcare facilities, because there would be lesser opportunities to introduce some of the concept. But this can also have same category of certification in 4 levels. So these are the plaques would be provided to any of the hospital which will get green healthcare certification. This is the process. So when any of the hospital wishes to get the green certification, they would try to have the registration of the project. This registration of the project would happen at our website, or sometime there could be email or phone calls also, like how to do it also. Once the project is registered, there are documentary evidence required for the hospital to demonstrate, to showcase they have implemented whatever 5 elements are demonstrated into this presentation. So these 5 elements will have lot many parameters, whatever we have discussed, into the tabular format. So these document would be submitted to IGBC. IGBC takes about 4 weeks time to review it and get back to you. But what happens, It is not only the IGBC reviews your document. Your document will also be reviewed by third party. If we only get your project, we only review and certify it, it's a biased process. So it is a completely unbiased process. Third party will also evaluate, and after third party, it comes back to IGBC. And we further do the quality check for that, and then get back to the project with the assessment report. So this is first phase, wherein we takes about 30 days time to get the project and get back with the feedback also. Once the project addresses feedback and then give back to IGBC for further assessment, it happens in the same principle whatever we have done the phase 1. So this phase 2 would be called like final review. This phase 1 would be called like preliminary review. Both the reviews would take about 7 to 8 weeks of time for IGBC, and then finally rating would be awarded to the project. If that rating is accepted, fine. If it is not accepted, having some problem for the project, or project is not happy or not satisfied whatever the decision IGBC has taken, it can also go back and do the appeal process there. But normally we don't see appeal would be done for like maybe less than 1% project, or maybe 2% project of the project as a whole. So this is the process of like having green healthcare certification there. We have done like many projects, which includes private, public, and some different hospitals which are running by government as well as private. And these hospitals, they really got benefited with regard to tangible savings and the intangible savings. So I would like to sum up some of the presentation here. Green healthcare elevates present level of medical infrastructure as a whole. It can enable environment which is really supportive to patient and to staff member to reduce the HAI. It is really having more resource conservation with regard to energy and water. We can simply target whatever the compliance route we have for energy and water. It can surpass them. And there are many more immense opportunities we do have to work together and transform the whole healthcare sector in India. Thank you for this opportunity, and I'll be really happy to have some questions and clarification from any of you.
Thank you so much, sir. Your valuable insights into the subject are highly applicable. Your slides were very comprehensive but elaborative at the same time. So this is the question and answer session, or any remarks that anybody wants to make regarding the subject, or anybody wants to share any of their experiences in green healthcare.
Shaista, if I may ask.
There's one hand raised, sir. Mahesh, sir, please go ahead with your question. Is there any? Yes, sir.
So, Dr. Shivraj, firstly, thank you very much for this wonderful presentation, and I think this will be useful for most of us. I just wanted to know if there is any fee also to get this IGBC certification that the hospitals have to pay, and how much is that?
So, sir, I did not mention the fee structure there, but when hospital will get registered with IGBC, there would be fee which is like 25,000 for members and 30,000 for non-members. Okay. Once the project is registered, then definitely they would go for certification. So during certification, we have 3 slabs defined. These slabs are based on the total built-up area. Suppose my built-up area is less than 2,500 square meter. My fee structure would be around 1.5 lakh or 1.7 lakh rupees. If that area boundary is more than 5,000 square meter, it would be around 2.5 lakh or so. And for the third, which is like largest hospital, it would be around 3.5 lakh rupees. It is also defined on our IGBC websites.
And is that a one-time fee or a recurring fee after some time, like annual or 2-3 years?
So registration remains single time for the project, and certification is valid for 3 years.
3 years. And then will there be assessment again after 3 years?
Yes. So what happens, once the hospital is certified, the rating is validated for 3 years, but in between every year there would be one program which IGBC has been running from last almost 6-7 years. It is called Performance Challenge for Green Built Environment. It's an award program. So all the certified projects would apply here to give their performance numbers with regard to energy, water also. And then they would be recognized for it. And after 3 years, they have to renew the certification, which we call it recertification. Recertification is much simpler than the certification. There would be half of the fee would be taken to recertify the project again for 3 years, and time is also only 4 weeks.
Okay, wonderful. Thank you.
I can see one hand raised. Yes, Dr. Prakash.
Yes, with the permission, Dr. Shivraj, thank you so much. Such an interesting talk and a wonderful concept. I just need to know that there is a lot of hesitation about the capital cost of creating a green building and especially a green hospital. So is there any study which shows how much exponential increase is there in the capital cost to make the hospital green from the beginning, ab initio? And how long does it take for the return on investment to come back? Because finally it ends up facing a lot of roadblocks on the financial side. So do you have some information that you could share with us?
So, dear madam, this is really nice question, and we face everywhere. And many people will ask about all these things. But see, suppose I'm not from IGBC, and I'm putting my feedback very clearly to all of you. What happens? We are having two types of client mindset. One client would be really interested to go for green, and cost is not a impact for them. So what happens? These would be doing the best and best and best, whatever the class we have for air conditioning or the ventilation or some of the hospital items, they would be trying to have the best. So their payback would be around 2 years, 2.5 years, 3 years time, because they are trying to have the best in class. Best in class means sometimes they will also import, which is not available in India, and sometimes they will be taking some of the measures which are really costly, because it has been invented, it has been launched in the market in like a very short duration. Okay, so market is not matured enough for that. The second type of clients, those are taking initiatives, and they are putting their wisdom so deeply. For them, what I understand, cost is not really, it is not even incremental cost for them. It would be a cost as same as what they construct for a conventional project, which is like green. So it does not matter at all. I will only give simple example for it. Suppose you have put your house, or maybe you have asked your architect to design a home, right? Suppose you have one window which is towards south, and the square meter is like 1. If you have 1 square meter window, your glass cost would be around, let us say 100 rupees or 150 rupees per square feet, just to cover your window with a good glass. But by mistake, we haven't put shade over window, right? You or maybe your architect has missed to create a shade for your window. You know what happens? If you don't do that, your glass cost would be 200 or 250 rupees to make the same comparison. So what impact we had created? We haven't done anything. In one case, we haven't put the shade. In one case, we have put the shade. Only creating shade in reduce my cost 100 rupees per SFT, and my performance would be same in both the cases. It is not like once I put the shade, my performance or the glass would have more heat for me to reduce by air conditioning. It is not. So this is like how we think about all the measures. Let me tell you another measure which is very relevant to hospitals, and you have seen in many of the hospital as well. We put air conditioner in every OT, right? Because of our requirement. We put AC in most of the ICUs, most of the NICUs. Suppose we don't think about the good measures there. What we will do? We will put the AC there, and we will cool the air to the tune of like 22 degree, 23 degree based on the doctor's requirement, and then we have a requirement to exhaust it, right? In some of the OT, it would be mandatory to exhaust 100% of the air, whatever we cool. So first we cool it at 22 degree, and then just throw it outside without thinking about it, right? This is one option we have created. In second option, what we will do, we again do the same requirement because we have to thrown out the 100% of the volume of air, but we will put the desiccant wheel there. If my exhaust goes here, my supply would come like this way. Okay, whatever the cool air which I pass through, it would having the chillness, which there would be many materials. These materials would absorb the chillness, and then while passing, it would pass through this chillness to the warm air, which we takes at like 45 degree, 40 degree, 50 degree, 30 degree, whatever it is. But definitely it is 5 to 10 degree higher than what we takes from the outdoor. Right. So in first option, we haven't considered the desiccant or heat recovery wheel. We are taking air and exhaust it. So our expenses are more there. And we haven't put any magic there for resource conservation. In second, our initial investment would be, suppose 1 lakh more, but how much we reduce every day? There would be some time when we really don't need to run our AC, like madam or some of the people there from Jammu. There would be temperature around 20 degree, maybe some 10% time of the year. Can we utilize that air directly taking into the OT and then exhaust it? It is possible. Because your requirement is not like my air should be coming and chilling it and then going back. Your requirement is you need to have 100% fresh air into your OT room throughout the operation. So when you incur your cost about 1 lakh rupees, payback is what? Payback is hardly 3 months time. So there are many measures which we can consider, but my request would be like, we need to invest time to think about it. We need to have architect and tell them like, I don't need your design tomorrow morning. But many times it happens like, sir, I have hospital and this must be ready within 3 months time. Then who will have time to think about it? Like what kind of good things we can put there? They will simply put whatever the conventional design practices we do have, and we are following from last 30-40 years. I think we can discuss like many such good examples, which will not have any incurring cost for the green buildings, but we need to think green.
Ma'am, hope
Thank
your
you.
question is answered.
Thank you.
Any
Thank you
other
very much.
questions, or anybody wants to share any experience?
If I may ask the follow-up to what Dr. Kashyap asked. Shivraj, how do you convince, I think the private sector may still understand and they would look into the cost benefit analysis, etc. How do you convince especially the engineers and the architects who work in the public sector? Are there any programs you do for them to improve their awareness about it and think in the cost benefit terms as well in the public sector?
Sir, I think a really good follow-up question. So I must be very frank to you. See, if we want to promote green healthcare in government, okay, what they would need, they would say like, what is the benefit? Benefit we can showcase, right? It is very easy to demonstrate also. Like we just took some good examples. There are many good examples, but they would say like there is no such nationalized requirement. Like I will not the name, but we were doing with one government agency, which is having some control for hospitals all across the country. What they mentioned like, okay, if I do my hospital green, what kind of recognition I get from the government? Then we said, sir, at this moment, government will not regularize you to do green building. They are only saying you please conserve energy. But there are huge transformation going up. Let me tell you very interesting update. Right now, Bureau of Energy Efficiency, which you know them very well, they are trying to put one code which will set all the requirement whatever we just spoke. And this code would not be called like energy conservation building code, because one department would ask for energy, another department would ask for water conservation, one more department would ask for something else. So they are trying to collect different verticals, and they are calling it Energy Conservation Sustainability Building Code. It is called like ECSBC. So right now it is under development, and this has been developed. This would be developed by IGBC, and if you know ISRE, which is like Indian Society, and IPA, which is like Plumbing Society, under guidance of Bureau of Energy Efficiency. So this work is ongoing, and hopefully it would be completed, and this code would be launched by our highest authority in the country, and it would set tone for like green healthcare so easily. We don't need to convince them. It is by default. By default, they have to make their building green. It doesn't matter whether you get certification or you don't get, but you have to make your hospital green.
Good.
Thank you so much, Dr. Shivraj sir, for patiently answering all the queries. I think there are no more questions and no more remarks. So I would like to end up the session by saying that green healthcare is a healing care that heals the patient with the touch of nature. Thank you so much.
Okay, thank you. Thank
Thank
you,
you.
Dr.
Thank you, Shivraj, and thank you, Shaista.
Thank you, Shaista Gai.
Thank you, sir.
Thank you,
Right.
Dr. Shivraj.
Thank you.
Thank you.
Thank
Bye.
you very much. Thank you, Shaista.
Thank you.